Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos. In this video, we're going to discuss the best ethical practices in video telemental health. I think it's important anytime you are working with any particular group of people, especially when we're talking about with video telemental health, that we need to review the best practices, but also making sure those best practices line up with what the ethics say as well. And so for the purpose of this video, we will focus specifically on the ACA Code of Ethics, but as a good reminder for you, whether you are a social worker or if you are a psychologist or any other type of mental health practitioner, many of these code of ethics really do echo some of the same sentiments. And so I don't want to feel like anyone is being left out in this video, but I do want to specifically look at the ACA Code of Ethics as it talks about best practices for video telemental health. So when we think about professional counseling competencies, one of the first things we need to think about is that ability to express empathy. And if you're working with a client in an on-ground environment, you already know that empathy is an important thing that we need to be able to connect with and share with our clients. One of the issues is sometimes is trying to be able to translate the empathy that we have in an on-ground environment into an online environment. And so I think it's important for counselors to make sure they're doing everything they can to work towards that space of being able to really show empathy and that to come across through video, that you are, once again, making them feel like they're being heard. You're building great rapport with them. You're feeling connected with them, and they need to be able to sense that through the video. And so I think this is an important competency that we should be working towards to make sure the client has the best experience possible in this counseling relationship. And I think it benefits you as well as a counselor as you're trying to connect with them. So just that ability to express empathy is very important. Another thing is just the issues of transference and countertransference, that this does not go away just because you're in an online environment. And so there may be times when your client is working with you and some of their own transference issues may be coming up in a session. It's important for you to be able to talk to them about that so they realize that there's some transference is going on. And so if you recognize that, that's something you need to speak to. But if you're having some of your own countertransference with your client, this is something where you need to talk to a supervisor about or talk to another therapist as well about, because countertransference and transference still happen in an online environment. So it's important for us to make sure that we are keeping that in check and that we're mindful of how we're coming across in those counseling sessions and also how our clients are coming across as well. Also, the use of fantasy. And so the reason why this is added in here is that as we are working with clients in an online environment, we're losing some of the ability to see body language, different things like that. And so the idea of fantasy comes into play where we are able to go and travel with this client wherever they're going with their story, but being able to once again show that we are engaged with them as we're trying to work through whatever it is that they're talking about. And so having this ability to use fantasy, that ability to use your creative mind as you're working with your client is a very important thing, because if we approach this from this way we do on-ground counseling, then we may not feel like we are using fantasy the same way. We may feel like that, well, I don't have to really show much more expression or anything. But I do feel like there is a bigger sense of expression and emotions that have to be shown on my end in order for me to be able to enter this world of fantasy with my client. So it's important for us to be able to have that as a part of what we're doing. And also patience. This is something else we want to learn as well, that as we are working with clients in this online environment, we have to be patient with the process. It is different from what we are used to in an on-ground environment. And so there may be things that don't work the way we want them to, or things may not just work the way that we intended for it to. And so we have to be patient with the client as we're working with them, and also patient with ourselves as we're trying to learn this new environment. And I think if you are working towards these competencies of being able to express empathy, to be watching out for transference and counter-transference, as you work with fantasy and you work with patience, you start to develop some competencies that help you become a very effective therapist in this online world. But these are some places, some things that we really need to be working on and growing in order for us to be effective as an online therapist. Now, when it comes to technical competencies, there's a few things we want to look at as well. First of all, is just the comfort with internet tools such as downloading programs or using various software. And this goes not only for the client, but also goes for the counselor. That we need to be comfortable with that process, because for many of us, we may be used to using computers and downloading software and things of that nature. But for some of our clients, this may not be something they are used to doing. And so having patience with this process, or even finding software that you can use where they don't have to download anything on their end, those are some things you may want to consider. But just making sure that you are comfortable with the programs you're using and knowing how to use them well, and also being able to teach your clients how to use them as well, because they may have some questions about it, and you need to be able to show them how to use software in the best way possible. And so that's just something to consider. Also, just basic computer skills such as adjusting settings, configurations, or adding hardware. For many individuals out there, you may be using a computer that already has a built-in video camera. I think pretty much all computers have built-in video cameras at this point. But for that higher quality pictures, some people are buying external video cameras for the computers, and those things are good. And so being able to buy hardware like that and being able to configure and set those up, maybe something that you aren't familiar with, but so this is something you want to get better about as well. And also, if you're in basic troubleshooting for your clients, if they're having any issues setting their computer up to be able to connect with you, being able to troubleshoot some things with them is a good skill to be able to have. Another one is just a toleration of the need for swift responses to clients or delays in responses from clients. And so basically having some type of policy that is built up where the client knows how often you're going to get in contact with them and how quick you plan on responding. So if you're doing video sessions and they're expecting you to be available a certain amount of time, make sure you actually are available during those time periods. But also, how quickly do you get back to clients once they do reach out to you? And so just making sure that is something that is already laid out beforehand is very helpful for the process, because the more comfortable the client feels about getting in contact with you and knowing that they can get in contact with you, the easier it's going to be for you to build rapport and to grow with that client. So just that toleration for need of swift responses is a big thing. Also, the ability to accumulate, store, and retrieve web links. I think it's important for all of us as we're working online that we can start creating some great web resources for our clients. And so just having that ability to know where to send your clients to find out certain information. Maybe there's information on depression or anxiety or something like that you want your clients to be able to read on, or maybe there's an article or something that you want to assign as homework. And so being able to keep up with those things in one place, to be able to store them, and also ability to be able to get those out to your clients is going to be an important thing to do. So I always like using resources like this for my clients so they can get more out of the session, and I also have time to connect outside the session with these resources. So just creating a good resource link and being able to access it in a way that the clients can get to that and use that as well. And also the ability to receive, store, and protect communications from clients. And so a lot of electronic health records are out there help you to be able to do this. Obviously, you want to use HIPAA secure software, which is we talked about in a different video, but in this video, I just think it's enough for us to say that you need to learn how to receive and store and protect communications from your clients, and do it in an ethical manner, and do it in a legal way as well, so that their information does not get to anybody that it does not need to be with. Also, when it comes to client screening, there's a few things I would definitely say that you want to look at as you're beginning to screen clients. The first one is just testing the client's knowledge of technical terms such as cookies and browsers and encryption, things of that nature. Many clients don't understand the differences in some of those things, and they may be connecting with you, and certain software you're using may specifically only work with the Firefox browser, for example, or it may only be able to work with the Google browser, whatever the case may be. But if the client doesn't know the difference between the different type of browsers, that may be some education you may need to talk to them about. And also cookies, understanding what do cookies do and how it saves your information. I think that's important for clients to be able to understand those terminology, and also just about encryption and what encryption means and how that affects them and the work that they do. So these are just a few things that you want to make sure you go over with your clients. Once again, I don't think you need to do a full class with your clients about these topics, but I think they do need to be familiar with these topics. So if they do have any problems on their end, they'll know how to be able to connect that way. Also, just find out the type of internet service your client has. That's going to definitely help with your screening. I use fiber optic internet service, and so I have a very strong connection whenever I do reach out to clients. But sometimes I have clients who will try to do their video sessions through their cell phone, and so many of them are in strong areas where they can do that, and so that works out fine. But in other areas, that doesn't work well for them. And there's still clients, once again, with dial-up service, and so that keeps them from being able to do video-based sessions. So know where and what type of internet service your client has, and be able to help them to see what's going to be beneficial for them. There may be some certain times where they may have pretty good internet service, and so my suggestion for them is going to, and also for the clinician too, is to make sure that you're connected directly to your router whenever you're using your service. That's just a lot more secure that way, and it also helps you keep a stronger connection as well. So just know what type of internet service your client has, and that's going to be beneficial to you. Also, when it comes to presenting issues, depending on what presenting issues the clients have, I screen them before I decide to make an appointment with them. And so I try to look at some of their past mental health history before I do make that first actual initial appointment with them. And so if there's been a long history of suicidal ideation or homicidal ideation, or if there's actually been attempts on these things, and there hasn't been really a long time period since this happened, for me, it may be best for them to be seen by somebody in an on-ground environment versus an online environment. And so just understanding what those presenting issues are is going to help me to know if they're the best fit for online counseling. So once again, it may not be the best fit for them, and so I just want to make sure they are getting the best service they possibly can get, and that may not necessarily be coming from me. So I just want to consider that. And also, you need to assess the comfort level of using technology in counseling. Some people just are not comfortable using a technology in general, and so we need to make sure our clients have the option of using technology. And if they don't want to do that, then this is an area that we don't need to force them into doing that. We want them to have a say in their care. So just talk about what their comfort is, And I've had many clients who will say, I've never tried online therapy before, but they're willing to try it, and they tried it a couple of times, and they end up saying, I really like this, and they continue to use online therapy. And then some of them got on, and we've done a couple of sessions, and they said, no, this just isn't really working for me. And I'm fine either way, but my thing at the end of the day, I want to make sure the client is getting the help that they need, and they get that help from me by me letting them have a voice in their care. And part of that voice I give them is by assessing their comfort level of what they're using technology in counseling. Now we want to talk a little bit about referrals when it comes to telemental health practice. That referrals occur when the goals agreed upon by the counselor and the client have not been achieved. I think this is something important for us to kind of focus on just for a minute, because there are a lot of times where when we are in this process, where we're working with clients in the online environment, and once again, they may not feel like this is working for them, or you may realize this is not the best way for this to happen. So if we're working together for a few sessions, and just like in our own ground session, if things aren't going the direction we thought it needed to go in, then the best thing for us to do is to make sure referral is being made. And so that's a really important process. Part of this process is to make sure that if we're not working or getting to the place that we need to get to, that's important to go ahead and make that referral for the clients. They are connected with someone who can help them better than we can. And I don't think there's any shame in that. I know sometimes I think therapists can get to this mindset, well, I'm the only person that can help this individual. And the reality is there may be someone out there better who can to work with these individuals. So referral is an extremely important part of our practice, especially in telemental health counseling, because once again, the specialty areas that we have may not fit for the client that we have. And so we need to be ready and open to make referrals. And so some different reasons when that we want to that when we refer. One is just when we have the inability to assist a client, where we just realize that I'm just not the best person to work for this client. And so I find someone who has that skill set to do what I'm trying to do. And so I'm going to go ahead and make that referral when I'm just not in a position to help them, or they're not making the progress I thought that we would be making by this point. And so that may be one good reason to go ahead and refer. Another one is creating additional support systems for the client, where they've gotten to a good place with counseling. And so you're realizing that they no longer need counseling, but they still need a good support network. So you have now created a good support system for this client. They now have a good place or in a good place when it comes to their mental health, but you still want them to be connected with people that can be supportive of them. So creating that additional support system is going to be important for them. That way, even though they're not actively in therapy, they still have a group to be around. So this could be like a online support group. It could be some type of recovery group they can go to. But the whole point of it is for them to have people that's going to support them once they're outside of therapy. Also, just when we are no longer able to be effective in the counseling process, sometimes I've heard the term before about the clients who we consider to be difficult clients, or this client is not progressing. And sometimes it's not necessarily the client. Sometimes it just may be our approach. That's not necessarily a bad thing. But if I realize that my approach is not working for my client, then I just need to once again get them to somebody that is going to work better with them. And so there's nothing shameful about that. There's nothing wrong with that at all. But sometimes we just need to be able to look at the situation and realize, am I the best person for them? And if I'm not, then let's look at finding another source for them to work with. And also when the client is relocating, as depending on where you're licensed and state-wise, things like that, your client may be moving out of the state where you are. So now it's a good time for you to start looking at referral for them. And so it's good to be able to help them to find another mental health practitioner to work with them, especially when the client is going to relocate outside the area that you're able to practice. And so these are just a couple of things to consider as we're thinking about referring our clients. Next, what we want to do is kind of transition a little bit, still in this topic of best practices, but we want to specifically look at the ACA Code of Ethics for distance counseling and technology, and see what this Code of Ethics has to say about how we should practice. And so one of the first parts it talks about here in H1A is our knowledge and competence. That counselors who engage in a use of distance counseling, technology, or social media develop knowledge and skills regarding related technical, ethical, and legal considerations. And it says in order to do the way you do that is by special certifications and additional coursework. So what ACA is really looking for us to do here is that in order for us to practice any type of counseling, and it's been specifically H1, specifically Section H is about distance counseling. It's saying that we need to make sure we have additional coursework in this area, and also, if possible, get special certification in this area. So we shouldn't just go out there and just practice this without having some type of training in this area. But there's also a difference between knowledge and competence, that we can know certain things about online therapy, but are you competent in that practice of doing it? And which is two different things. And so there's a knowledge component to this, that we need to know what we're doing, but also be practiced well enough that we have competence in this area. And it's helping us to see that all this comes from training. So I always emphasize to individuals that's important for you to get education in this area. It's also important to get continued education once you've get licensed and things of that nature, because it's going to help you to get to grow. And plus, telemental health counseling is one of those things that changes quite often. And so something you learned 2 or 3 years ago may have changed. And so it's important to get the most up-to-date information as possible. Also, laws and statutes that counselors who engage in the use of distance counseling or technology and social media within their counseling practice understand they may be subject to laws and regulation of both the counselor's practicing location and the client's place of residence. Counselors ensure that their clients are aware of the pertinent legal rights and limitations governing the practice of counseling across state lines or international boundaries. Now, this is probably one of the most controversial topics that comes up in telemental health counseling. Is that question that comes over and over again? Do I have the ability to counsel across the state lines? And I always say maybe. And the reason why I say maybe, according to the ACA code here, it says there's two things that there's actually three things we need to be looking at. It says we need to look at the legal aspect of it, the laws and regulation of where the counselor practice location is, and also the client's place of residence. And so a good rule of thumb is like at the time of the counseling session, where the counselor is at that time and where the client is at that time period, we need to make sure that we're checking the laws and statute in both places, because I may be out of state in a different state practicing, but I may not be licensed in that state, and that state may have different laws than what my original state is I'm in. The same thing for your client. So it's important for us to understand that we understand that, and our clients understand that as well, but because this is a legal thing we're talking about, because state governments have the ability to give counseling licenses, and they're able to say who is able to counsel in their states. And so even though you may be licensed as a mental health practitioner in the state that you're living in, it really doesn't make a big difference when well, it does make a big difference when you go someplace else. You can say all day that I'm licensed in like I'm licensed in Arkansas, for example. And so if I go out to Colorado and happen to be out there and I'm doing sessions, I can't just say, well, I'm licensed somewhere. No, that state is able to regulate who practices there. And so they have laws that you have to follow. So it's always important, once again, at the time of that appointment, where the client is located and where you are located as a therapist, are you licensed in both those places? If not, contact the governments in both those places, contact those licensing boards, and make sure you're practicing in the right way. And same thing for international boundaries. I see a lot of advertising for people who are trying to help out when there's crisis situations in other countries and doing counseling internationally, which I think these are good things. But once again, we have to make sure that we are looking at the international boundaries, and do those places have licensing for counselors? And so if they do, you need to check and make sure see what the laws and rules are. Also, an H2A talks about informed consent and disclosure. The clients have the freedom to choose whether to use distance counseling, social media, or technology within the counseling process. In addition to the usual and customary protocol of informed consent between counselors and clients for face-to-face counseling, the following issues unique to the use of distance counseling and social media are addressed in the informed consent process. So let's talk about this part first before we get to the informed consent. What this is basically trying to help us to see is that when our clients come in contact with us, and we're wanting to work with them in an online environment, one of the first things we have to look at is that for them is the reality that they have the freedom to choose if they're going to do it or not. So basically, I can't force my clients into a place where they have to do online therapy. If they choose not to do online therapy, then I can't provide that for them. I need to either do it on ground with them, or I need to find them a therapist that will work with them on ground. So with me having a 100% online practice, I tell all my clients when we first start that, hey, I am a therapist. I do take your health insurance, but I'm 100% online practice. And when they hear that, it helps them to make a decision. Okay, what does that mean? So I explain what that means, what the processes look like. And for some of them, they're like, nope, that's not something I want to do. And for other ones, like, yes, that's what I want to do. So you have to let them know what you're doing, how all that works, but the client chooses what's best for them. And so we don't choose based on what we're able to do. We choose based on what they are wanting. And so if they're not wanting it, we don't need to force them into that situation where they feel like they need to do that. Also, here in H2A is helping us to see that we need to make sure we have an informed consent, specifically for our online practice, to help them to see what is going to go on and what's involved in this online counseling practice. And I always tell people that if you're going to do an informed consent, make sure you have make sure to have two different informed consents. That if you're doing telehealth only, or if you're doing a hybrid where you're doing one on ground, one online, to have two different informed consents. That way, your clients who are on ground understand what that looks like. And if your clients are meeting you online, they know what that looks like. So always have those two separate informed consents. And so this is what the code is saying we should have inside of our informed consent. First of all, it says we need to have our distance counseling credentials. So where were you trained? What type of training did you go through? We need to make sure we have that in our informed consent about what type of training. If you just say, well, I watched a bunch of videos, well, that may not be enough to show that you actually have credential or training in that area. So you need to make sure you are providing information to your clients so they can know that you actually have training in this area. Also, the physical location of your practice. So if you are in a certain state, in a certain city, they need to know where your physical location is, so that they know where you are providing services from. That's going to help with insurance and other things of that nature. And also your contact information. So you need to, once again, if your phone number, your email address, different things like that. If you have a website, you want your web address up there, but they need to be able to have that information. And so these are this is kind of the starting part of that informed consent. Also, the risk and benefits in using distance counseling or social media. And so it's important for them to know what are some of the risks of you doing therapy this way. They need to know that prior to beginning this process with you. And then also, how can this mode of counseling benefit them? And so both of those need to be included as a part of this process. And the reason why it's important for that to happen is because now the client has this ability to make an informed decision. That's why the informed consent comes in. They can make an informed decision on whether or not this is a way that they want to practice or not. Also about the possibility of technology failure and how alternative services will be delivered. So when we see this happening, whenever a technology does fail, we need to have some type of way already lined out in our informed consent on how you end up contacting your client if that happens. So if the power goes out or if the internet goes out, whatever the case may be, how would they get in contact with you in the middle of a session once that happens? Are you going to call them? Are they going to call you? What's that process look like? And the more of this stuff you do up front, the better, because now there's no guessing going on and they know exactly what to expect. And also an anticipated response time, that if a client reaches out to you, how quick do you get back to them? It's going to be within 24 hours. It's going to be within 48 hours. They need to know what that looks like. And so it's important for that to be as a part of your informed consent. Also, continue with it on informed consent. You need to talk about your emergency procedures to follow when you are not available. And so, if you're going to be out of town for a week or for vacation, or you're going to be away where they can't get in contact with you, who do they contact in need of emergencies? And so, sometimes people may have an 800 number they will call. Maybe they have another counselor on call for them. But whatever it is, that needs to be in your informed consent so clients know exactly what to expect, and how to deal with that during that time period when you are not available. Also, time zone differences. This is something I deal with all the time. That you may live in one time zone and your client may live in a different time zone, but you may still be in the exact same state. And so on scheduling, getting that figured out, and making sure that you're always on the same page on the time zone differences. Also, cultural or language differences that may affect delivery of services. That there may be some differences in culture between you and your client, and you need to be able to acknowledge that. I know that from a multicultural perspective, you realize that everyone is different, and so there may be some things that they are more comfortable talking to you about because of culture, or some things they may not be comfortable talking to you about because of culture. So make sure you address that in your informed consent about how you deal with cultural issues that may come up, or if there's language barriers that are there. How do you plan on dealing with that in counseling? Also, the possible denial of insurance benefits. Insurance changes all the time. Sometimes insurance will change the amount they reimburse for online therapy, or they don't pay for it at all. And so, once again, there's a it can possibly be denied. And so, what's that going to look like when it comes to fee payment and things of that nature? And also having a social media policy. And this is where you are outlining to the client how you will be able to interact with them on social media, and so they can better understand that process. So those are some important things that must be a part of our informed consent document that you want to make sure that we are getting to our clients. Next, it talks about confidentiality maintained by the counselor. The councils acknowledge the limitations of maintaining confidentiality of electronic records and transmission. They inform clients that individuals might have authorized or unauthorized access to such records. So what we're trying to do here is help them to understand that nothing is ever 100% secure. Now, it would be nice if it was in some ways, but we know that's not the reality. And so we're not saying that they're taking a bigger risk by being online, but we want to let them know that there is a risk online of someone being able to get access to their unauthorized access to your records. Now, you can also tell them all the things you're doing to make sure that doesn't happen, and to put them at ease. But the reality of it is that people, information online can be hacked into. It can be looked at inadvertently by other people, and so we do everything we can to make sure we are protecting client data. And I would talk about what the process looks like. But once again, confidentiality, we want to make sure we're acknowledging to them there are some limits to that in an online environment. Also, counselors inform clients about the inherent limits of confidentiality when using technology. Counselors urge clients to be aware of authorized and unauthorized access to information disclosed during the medium in the counseling process. So even in the counseling process, the software and things that we use, that sometimes sometimes those aren't as secure as they need to be. And so maybe you're using a video-based counseling for your client, and realize that, and you come to find out there are people who know how to hack into the information if they choose to do so. So once again, what you're doing the best you possibly can. So we use HIPAA secure software. We do it in a HIPAA compliant manner. We change our passwords. We go through the whole process, but we still let clients know that it's still possible for their information to be viewed by unauthorized people. And so this is just, once again, acknowledging there are limitations to technology. Next is just security. And here it says that counselors use current encryption standards within their websites and or technology-based communications that meet applicable legal requirements, and counselors take reasonable precautions to ensure the confidentiality of information transmitted through any electronic means. So basically, what we're looking at is we want to make sure that our websites that we're using, our email, any way that we are transferring information, even our electronic health records, that we are using encrypted software for that. So we're looking for software that's HIPAA secure, that has certain encryption standards, and we look for those and we use those. And so I think it's important for the client to realize, well, what type of encryption you are using in your software, and you don't have to go into like the super technical parts of that, but to help them know that you use encryption as a part of your counseling process, and so you're doing everything you possibly can do to meet legal requirements, so that information stays protected. Also, talk about client verification. That counselors who engage in the use of distance counseling make sure to interact with clients and take steps to verify the client's identity at the beginning and throughout the therapeutic process. And so verification can include, but it's not limited to, using code words, numbers, graphic, other nondescript identifiers. And I know for me, this is something that I do with all of my clients. I do go through a verification process with them when I work with them. And so it may be a thing where you're asking for a picture ID during that first counseling session to make sure that you have a connection with them in that way. And so that may be one way of doing that client verification. I also do a password for all of my clients. I'll ask them for a password that they can remember. And that way, if we ever get online, I have any questions, well, that is them, I'll ask them what the password is. And so, and I usually actually verify it every session. So, ACA code says we should do that the first session and throughout the therapeutic process. NBCC actually says we verify it every session. And so I try to verify it every session. That way the client don't forget their passwords and it becomes a normal part of the process for them. So client verification is one of those things that is ongoing because we want to make sure the clients that we know who we are actually working with on the other end. Also, benefits and limitations. The counselors inform clients of the benefits and limitations of using technology applications and providing counselings. And some of that, when this comes to computer hardware, software, whether you're using the phone or social media, whatever the case may be. But basically, we're trying to help them to understand the benefits and limitations of using technology applications. Sometimes technology just doesn't work the way we want it to. And so that becomes a limitation. Or sometimes it doesn't work well, depending on our internet provider or whatever the case may be. So it's important for us to make sure we help them to see that this is how using online therapy can benefit you, but here's also the limitations too. And once again, this helps them to be able to have an informed knowledge of what they're about to get into. So this becomes very important for them to know the benefits and the limitations. Also, some professional boundaries in distance counseling. The counselors understand the necessity of maintaining a professional relationship with their clients. So counselors discuss and establish professional boundaries with the clients regarding the appropriate use of technology and a limitation of it with this. And so basically, we want to be able to, well, my clients to know that there's certain boundaries that can't be crossed when it comes to social media, when it comes to confidentiality, things like that nature, that we talk about what these boundaries look like. And the reason why this is important is because I want to be as beneficial as I possibly can to my clients, but a lot of times, if we don't set these boundaries, then those boundaries can be pushed by clients, and that can cause an unhealthy boundary between us. And so I'm going to make sure that they know what these boundaries look like from the beginning. I'm going to explain this as well. That way there's never any doubt in their mind who I am as I'm working with them, that our relationship is a professional relationship, that we do things and we have a therapeutic relationship. And so these are all things that are really important to us. And so establishing those professional boundaries is important. And when we do that the right way, it helps to keep everything professional. Also, when it comes to tech assisted services, that when we're providing tech assisted services, counselors make reasonable efforts to determine that clients are intellectually, emotionally, physically, linguistically, and functionally capable of using the application, and the application is appropriate for the needs of the client. And so there's a lot of stuff that's packed in here. So what it's saying is that when we're using technology, does the person have the intellectual ability to be able to use this software that we're working with them on? And if they do, great. We want to continue to use it for them. But if they're not able to, then we may have to find a different way to connect with them. Also, are they in a good emotional state to be in this online environment with us? And so we have to be able to determine that are they ready to be in online? Would they have a little bit more freedom and a little more in that way? Or do they need to be in a face-to-face situation with the therapist? We need to kind of assess that as well. Also, are there any physical capabilities that our software makes it so our clients aren't able to use? And so, if the software I'm using is not working right for some people who maybe have some physical things that they're not able to do, are we doing the best for our clients? So we may have to actually change the software we use in order to make sure it works for everyone, regardless of their physical abilities. Also, linguistically, we have clients who speak different languages. Does our software support that? That's something to consider as well. And is our software functional enough so that anyone is able to use it? And so for me, it's important to make sure we have software that we know how to use, that we practiced with it before and we've used before, because when we do that, it helps us significantly when we're trying to connect with our clients. And so this is just saying that we need to be doing our own work on our end to make sure that the client is actually ready to engage in this online environment with us. And the way we figured all that out is by going through the steps of understanding the intellectual, emotional, physical, and linguistically and functional capability of our clients, and also of the applications that we're using. Also, the effectiveness of services. So when distance counseling services are deemed ineffective by the counselor or the client, counselors consider delivering services face to face. If the counselor is not able to provide face to face services, the counselor assists the client in identifying appropriate services. And I talked about this a little earlier when I was talking about referral. So basically, if distance counseling is not working well, it's not effective, it's saying we need to move on. We need to get them in contact with someone, maybe to provide face to face for them, because that's the best for the client. And so as we look at all these things in the code here, everything once again points towards what's best for the client and for the client's growth. And so we want to make sure we're focusing our mind on that. And so we need to make sure we're being effective. We need to make sure we're doing it actually helping. And if it's not helping, then it's probably harming the client. So we want to make sure that we are doing everything to help them. And so we realize that it's not being effective, then we need to help our clients get to be with someone who can be effective with them. Also, access. The counselors provide information to clients regarding reasonable access to permanent applications when providing technology assisted counseling. So when it talks about information, they need to be able to have access to information that we have on our clients or pertinent applications. So are we using software that is hard for our clients to use? Are we using software that they have to pay for on their end as well? How much access do our clients have to be able to actually connect with us? And are we using software and hardware that's going to be something that's easily accessible for them? And so once again, we need to think about that as well to help our clients be informed on the software that we're using, how to be able to use that so they feel comfortable with it, and so they can have easy access to be able to doing that. But if they don't know how to access it, if they don't know how to use it well, and we're not willing to do the teaching aspect of it, then we're putting them at a disadvantage there. So that, once again, becomes another important part of this as well. Also, communication differences in electronic media. That we have to realize that when we are communicating in an online environment, that is much different than communicating in an on-ground environment. And so we need to educate our clients about how to prevent potential misunderstandings that arise from missing visual clues. So if you're using video-based services, you're basically getting a small square. You're seeing a certain part aspect of the client, and so you are missing out on a lot of visual cues. And so when that happens, we need to make sure we're letting our clients know that we are missing those visual cues so that they know that we have to be pick up on other things. And so I think this puts, for me, this puts more of the work on the client to on the therapist actually to know how to be able to pick up on these verbal and nonverbal cues from the client, if especially when we're in an online environment. And so the communication is going to be different. Maybe the way we engage them is going to be different. Maybe the way we build rapport is going to be different. So we just got to recognize that communication online is different than it is in an on-ground and traditional counseling. And so both of them have their merits, but in online, we have to approach it differently because it is a different process. Also, records. It says counselors maintain electronic records in accordance with relevant laws and statutes. Counselors inform clients on how records are maintained electronically. This includes, but is not limited to, the type of encryption and security assigned to the record, and if how long archival transaction record is maintained. So you notice here, it does not give anything specific on how long that we keep records. But it is saying that when we do keep records, we need to let our clients know what type of encryption we're using and how long we plan on keeping their records. And clients should be able to have access to their records that they have. So if I'm only going to keep those for 5 years, and so a client comes back to me after 7 years and now they're looking for their records, if we didn't let them know in our informed consent or didn't let them know about the how long we're keeping it, that may be something that could be harmful for them. So that's just, I think it's just a good practice to make sure they know this is how long I'm keeping records for, So I would definitely say check with your state laws on how long records need to be kept. And when you do that, it's going to help protect you on that. But you also need to make sure you're verbalizing it to your client as well. That way they know exactly how long they can have access to their records. And once again, how are you encrypting those records? Also, when it comes to clients' rights, that counselors who offer distance counseling services or maintain professional websites provide electronic links to relevant licensure and professional certification boards to protect consumers and client rights and address ethical concerns. So literally on my website, clients, I have a picture of myself. It tells my clients who I am, and I have a place on there that says verify this person's ID, or verify the client's, the counselor's license. They can click on that button. It takes them directly to my counseling board's website. They can type my name in there, and it will pull up all the information about me to show them that I'm actually licensed. And so the clients have right to the information. So we want to make sure we're putting links on our websites that helps the clients to be able to check, make sure that we are licensed, but also if they have an ethical concern, they know how to be able to get in contact with our boards if we don't have this information provided. So this is something that is important to make sure we are providing. Also, multicultural and disability considerations. The counselors who maintain websites provide accessibility of persons with disabilities. They provide translation capabilities for clients who have a different primary language when feasible, and counselors acknowledge the imperfect nature of such translation and accessibilities. There is a lot of great software out there now that you're able to integrate into your website, where it at the bottom of your website you can actually like click a button and it will translate the whole website into a different language. Yeah, and there's a lot of stuff out there that you can do to your website to make it more accessible. So we need to be aware of our clients who may need our services, but who come from different backgrounds. Now, you may be thinking, well, if the client's coming in doesn't speak the same language as me or things like that, or why should I have this information available? Well, there may be resources on your website that may be helpful for them, and so just for them to be able to know who they can go to is helpful. So once again, we just want to make sure that they have access to information. That's what a lot of this is about. And even though those translators are not always perfect, it's better than not having anything at all. And so just that, so having some way of being able to translate your website is going to be important for your clients. So we've talked quite a bit today about the best practices, the ethical best practices of telemental health counseling. And I think the best way to kind of summarize all this up is that ethical practice is always the best way to practice. That we need to be looking towards our codes of ethics when we're trying to practice online and know what our code of ethics say. Once again, I know we focus primarily on the ACA Code of Ethics in this video, but most of the other code of ethics, whether you're looking at the NBCC Code of Ethics, the NASW Code of Ethics, or even if you're looking at the APA Code of Ethics, or the Marriage and Family Therapy Code of Ethics, a lot of them are saying some of the same things when it talks about how to practice online and things you need to do. So make sure you are checking specifically which your code of ethics, the one that you are following in your state, for the specifics of what you need to do. But I feel like the ACA is a really good one to help us to get a better understanding of how we can practice in the right way, but also do it in an ethical manner. I hope this video has been helpful to you to better understand how ethics and practice go hand in hand.